Okay, good afternoon. Hey y'all, I'm back. Duh, I'm back. Obviously, y'all are watching, but hey y'all, what's up? What's up? I'm so excited to be here with y'all for another sit down and chat video on Life as a Neonatal Nurse Practitioner, but this time we're coming at y'all with some tips, with a list of things. As you can see by the title, I'm coming at y'all with some survival tips for surviving clinical as a neonatal nurse practitioner or neonatal nurse practitioner clinicals for school. So I have a list of things. I got the top 10 tips. These things I feel like are what helped me. I also feel like I wish somebody may have told me some of these things. I've also witnessed other students go through things or experience some of these things that I feel like these tips, or I've talked to them in the moment and these tips have helped them as well. So I definitely know for sure that these tips are helpful. There are many more that are out there. So if you are already a neonatal nurse practitioner, or even if you're a nurse practitioner in a different field, I feel like clinical in general, there are tips that, we could all use. So if you have any tips that I did not mention, please comment below some of those tips, but we're gonna get right into the video. I do have my little notepad here. So I'm gonna be reading from it because I can't remember anything from heart because pregnancy brain is a thing, mom brain is really a thing. So I be forgetting things. So I definitely had to make a list. So we're gonna go ahead and get right into it. These are just some talking points, and then I'll kind of just go off the top of my head with details about the talking points. So the first one, the top tip that I feel like everyone should follow for sure, is to treat your clinical like a job interview. Treat it like a job and job interview, because first of all, that's what it is. Obviously you're doing your clinicals, but you likely are going to apply for a job at the place that you do clinicals at, because you're out here trying to get a job. You're applying everywhere and we're watching you. The nurse practitioners that you're working side by side with, watching you, the supervisors, the higher ups, the doctors, everybody is watching you. I don't say that to make you nervous. I just say that to be mindful. Be mindful of those things. So when I say treat it like a job/job interview, it's just job etiquette things that we all know, but sometimes we just forget about because you think, oh, you may think I'm a student, so they're not expecting this of me. But no, it's professionalism, absolutely. So some of the things that I want you to consider when you treat it like a job/job interview: number one, be on time. So by be on time, you heard this. To be early is to be on time. To be on time is to be late. To be late, you never should come. No, I'm just playing. But for sure, try to arrive at least 10 minutes early. Be there. That way you can just be kind of prepared, especially if it's your first day of clinicals. You want to arrive 15 to 20 minutes early, because hospitals usually are big. You usually don't know how to get to the unit sometimes, maybe if you didn't get a tour or anything like that. So you want to have parking, traffic. You want to just account for all of that. So leave a good amount of time home early that first day, especially even if you arrive 20-25 minutes early that first day. Obviously you can push it back a little bit, but no matter what, for every day it's a job interview. So maybe try to come at least 5 to 10 minutes early. That way you can have your coffee, you can some of these other tips, you can do that, unwind, prepare your mind, but you're already there. You've already bypassed any type of encounters that may happen. So definitely be on time, be early. Dress professional. Obviously we wear scrubs at clinicals, but even still, make sure your scrubs aren't don't have stains on them. Make sure you're showering, literal stuff. You may think, oh duh, we all know that, but it's things that just need to be pointed out. Literally be professional with your wear. Make sure you don't have on big hoop earrings, how you would dress as a nurse. For that work, you want to dress for clinical too. I don't really see us in our field wearing that type of stuff, but that's just an example. Just try to make sure you're dressed clean and you're looking professional. Also being mindful and communicating. So if you're not going to be able to make it to clinical, if you're sick, if something happened, a family emergency, et cetera, et cetera. Obviously some things just happen at the certain time that it happens, but if you have an advanced time to be able to notify your clinical instructor or the supervisor, whoever's contact information you have, try to notify them in advance. That way, like, again, it's professional. Like, that way they have a heads up. We are teaching, or we know we have a student. A lot of times our morning is tailored towards that. So that way we can have a heads up of how we know, like, okay, I may have to like slow down. Like, we can have a heads up as well. So for sure, treat it like a job interview. That is tip number 1. Tip number 2, always be willing to learn. Be eager. You're a student. This is clinical. You should be excited. If somebody asks you, do you want to do a procedure? I don't care how many times you've seen a procedure. I don't care if you even done the procedure at previous clinical sites. You better never fix your lips to say, I've done it before, I've seen it before, I've heard it before. Nah. It is, yes, I want to do it. You just hop on it, because first of all, this is your opportunity. Like, right now, you never know when you're going to get a chance to do this UAC, UVC, lumbar puncture, chest tube, intubation. Like, you never know when you're going to get another opportunity. So you never reject the procedure. I don't care how comfortable you think you are. The more you do it, the better you get. So you want to continue to practice. So always be eager. And also, that is like, we're looking at that type of stuff. If somebody's just like, I've seen it before. I did like 5 in my last clinical. We're taking note mentally, like, oh, this person's not, you know what I mean? Like, she's not really eager. She or he is not really eager. Like, we don't want to hire somebody like that, So those type of things are being watched for. So be eager. And then even, well, I guess this kind of ties into my next point. But even when it comes to like disease processes, like, of course, if you already heard about it or you know of it, it's always fine to be like, yes, I've heard that. Like, yeah, this, but don't just be kind of nonchalant about it. Like, yeah, I already know about that. Or, yeah, I work with that many times in my job. It could just be like, yeah, I've seen a patient like that. You can be eager and just show like, because this is our field, like, this is what we do. So you should want to talk about it. You should be excited. And if you're talking to a doctor or another nurse practitioner, they may be asking you, but they may be able to give you a different insight. So don't ever brush it off like you just know every single thing about that particular disease process. Obviously, if you know something about it, share it. But do it in a more humble type of way. Don't be cocky. Which brings me to my next thing. I'm gonna go ahead and slide to number 3, which is don't be a know-it-all. So obviously, like I said, yes, if you heard of something, that is perfectly fine, but it's how you project yourself. It's how you respond to this opportunity to learn about something. For example, let's say one of the least common things that we get is an exchange transfusion. So say that a doctor wants to ask you about a reasoning for exchange transfusions, and you can be like, oh yeah, I know all about that. Like, it's obviously hyperbolic, like, you know what I mean? But there could be other reasons as well. There's so many different disease processes that we don't see on a daily basis, that there could be other stuff. So you could say, yes, I've heard of an exchange transfusion. I know it's most commonly used for hyperbilirubinemia, but is there something else? Is there another reason? Is there something I'm missing? Or could you teach me? Like, still be eager to learn, show your knowledge, but be humble, if that makes sense. So just don't be a know-it-all. Don't overtalk the doctors. Don't overtalk your nurse practitioner, the person who's teaching you, your clinical instructor. Obviously, if they're disrespectful to you, be an adult about it, be professional. But usually people aren't disrespectful. If we're teaching you, that's not disrespect. Be respectful. Be eager, listen, and then if you could just listen, don't cut them off in the middle. If I'm telling you, okay, about this blood gas, blah, 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 like, yeah, you may know, or you may have an idea, but also let me teach you again, because redundancy, as you hear it more and more, you become better with it. So just don't be rude. Don't be a know-it-all. Don't cut someone off when they're trying to teach you something, even if you already heard of it before. You can listen, let them finish their sentence, and then you can say, oh yeah, I heard of that. You could just be kind and humble about it. So that's tip number 3. Tip number 4, and a lot of people don't realize this, and you get comfortable sometimes, and I understand, is don't talk negative about your current job or a previous clinical facility. People are listening. The neonatal nurse practitioner world is small, despite what you may think. We talk like everybody, somebody knows somebody. Like, we know other people all over the place. So just be careful who you talk to. Not to say don't trust anyone. It's just, I'm sorry, I looked up. It's the windows right there. A bug flew Even though it's a window, it was big. I was like, is it coming in the house? But anyways, I'm sorry. It's still that thing where it's like a job interview. In a job interview, if someone said, so why do you want to come? Why do you want to come work for us? You wouldn't be like, oh, I work for blah, 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 and they're so rude and they're this and that. You wouldn't do that in a job interview. So don't do it at clinical. You don't want to, it's not professional. And then we worry, would you do that about this location? You know what I mean? So you just have to be mindful of that. And obviously if you get the job, if you start working there, you have someone you can confide in and that you completely trust, you pull them to the side and you can talk, you want to vent, you may do that, but it's how you do it. And again, the world is small, so you just want to be careful. So don't get too comfortable too soon. Try not to talk negative about those places. You can be factual, you can be objective, like, oh, my job doesn't do this. Oh, where I work, we don't do that. Oh, where I had my previous clinicals, they did not do that. But you don't want to be like, oh, the way they practice is crazy. Like, I wouldn't, you know what I mean? You just don't want to talk like that. I'm trying not to go too deep into each point because then this will be like 55 minutes long. So yeah. Number 5, go home and review the disease processes. So yes, we've heard of things, we know things, you're in school, you're constantly learning, but if you're in clinical and something comes about, let's say hyperammonia, that's like even right now, like if I see that, I'm gonna go review it some more. Let me think of another good one. A congenital heart defect. I know you may have studied it in school, but now you actually are experiencing it. You be there, you be in the moment, you review, you ask questions, you listen, you learn. But when you finish clinical, go home and review it. Go find it in one of your one of your school resource books and study it, take some notes on it, kind of think about what you saw today versus what you're reading about. Go home and review that. And because you digest it more, you understand it better, and you won't forget it. So definitely when you come about something that you haven't experienced or that you don't experience often, go home and review that information on that particular disease or diagnosis. Number 6, this is my favorite one, honestly. I don't know how it made its number 6. These are not in any particular order, if I'm being honest with you. This one is a big one because I still do it. And I have this thing where I always apologize. I'm sorry, I have a question. I have another question. Ask questions. No question is a dumb question. You are a student for a reason. This is your time to learn. Obviously, when you become a nurse practitioner, you're still learning and you can still ask questions, but this is the moment when you're just like that little baby out the womb and you're just learning so much. This is the best time. And plus, when we hear you guys ask questions, or as a student you ask questions, we love that. Obviously, depending on the moment, but really don't ever shy away from asking questions. We just feel like that also shows that you're eager to learn. That shows that you're listening. That shows that you're going to be a good nurse practitioner because already you're not ashamed to ask questions. You want more. You're hungry for more information. Like you want to understand it better. So never be ashamed to ask a question. Also, especially to the doctors, like when you're in rounds, because we work with them like side by side. Like they go to school longer. They understand things on a so much different level, especially like the science behind things, like the chemistry behind things. So they can explain things to a certain level, sometimes better than we can as a nurse practitioner, or more in detail. Let me say that, in more depth. So you may ask your preceptor and she may answer you, but she likely can say, also ask Dr. So-and-so in rounds as well. Not only is it good to ask a doctor to get a different perspective, to get more in depth on that answer, but when you ask in rounds, everyone else learns too. And it shows also that you're confident in learning. Like it shows that you're not like someone too shy who waits to go pull someone to the side. Don't be ashamed. Ask in front of people. It looks good. And also everyone else is learning. 9 times out of 10, somebody else had the same question as you. So please don't be ashamed. Ask questions and never stop. Number 7. This kind of goes into the last point, which is try to critically think. So a lot of times, either when you're working with us and we're preparing for rounds and we're doing numbers and things like that, we may ask you, why do you think this is happening? Why do you think this baby is acidotic? why do you think her sodium is so low or so high? Why do you think her potassium is so low or so high? Why is her heart rate high? Like, we may ask you these questions, and we don't expect you to know everything, but we want to see you try to critically think. So if we ask you a question like that, take a moment, take a breath. Like, if you know it, obviously go ahead and spit it out. But if you aren't quite sure, or if you think you know but you're not 100% confident, show that you're thinking. Speak it out loud. Like, she's a premature baby. She's 26 weeks. Their kidneys in the beginning are usually immature. So likely her sodium is high because she's peeing so much. She is diuresing so much. So it's making her sodium higher. And you can just kind of talk your thoughts out loud, right? And we like to hear that stuff because it's like she's really thinking. Even if you're wrong, we can redirect your thought process. So don't be ashamed. You're learning. And this is something that I had to learn. I was like that too. I'd be like thinking it inside, and it's like, what are you thinking? Just talk it out loud, because you're a student for a reason. That's why you're learning. So don't be afraid to get it wrong. Don't be afraid to get it wrong. But also, don't be afraid to say, I don't know, in the same breath. And like in rounds, doctors are going to ask you stuff. You can, show that you're thinking like, But you can also, like, you could think for a second and just be like, if I'm being honest with you, I've never dealt with this. I never experienced this. I heard of it before, but I'm just not quite sure. Show like that you kind of are thinking about it, but you really just don't know. You don't want to sit there. You don't have to sit there and think forever, like, and then beat yourself up about it. You'll feel more confident when you, if you truly, absolutely, if you have an idea, spit out your idea. You can get it wrong, it's fine. But if you just absolutely have no idea, because let me be honest with you, sometimes the questions can get real, like, sometimes I'll be sitting there as a preceptor, and they're asking my student, and I'm like, I never thought about that. Like, what was I saying that for? It's okay not to know also. So don't be ashamed if you don't know. Always try to critically think. Okay. Number 8. This is a good one as well. And I think I did find someone, but find a mentor. You don't have to do this alone. Find another neonatal nurse practitioner that you absolutely love, that you can trust, that you gravitate towards, that's not judgmental, that's not super hardcore, that can answer your questions even when you're like at a different clinical, obviously, like the timing and everything, or you can vent to, or you can call and tell them about your day or something like that. Find somebody that you trust, that you can talk to and just share your experiences with, or ask questions outside of the clinical setting. That way, you can feel heard and you can feel understood, because this neonatal world, as you know, because if you're doing this, you're a NICU nurse. But for those who are watching and are not quite there yet, or just not doing it, but just supporting, thank you. This world is really small, so it's really hard for everyone to understand exactly sometimes when we need a vent or something like that. So it's always good to find a mentor or someone who can give you advice or tips or things to help you get through throughout your clinical and school, or even when you start working as a neonatal nurse practitioner. So find a mentor. Number 9. This one's a good one, but it's kind of it's when I say it, I have to explain it. Fake it till you make it. You are going to be nervous. Likely, there are some people out here who just got it. You just got it like that, excuse me. But likely you are going to be nervous. Like, you're new, you're learning, you sometimes don't know. You're around people you don't know. Like, you're just in a whole new setting, in a whole new role. It is nerve-wracking, and that is understandable, and that is okay, absolutely. But try to fake it until you make it, girl. Listen. I feel like the most nerve-wracking part for many people, including I think myself initially, was rounding. Like, you want to get it right. You have all these people listening, because in rounds, for those who don't know, rounds is what we do in the morning, multidisciplinary rounds, and it's usually every place is different, but I'll just say it's usually the attending that's on the nurse practitioner, you with your clinical instructor, and maybe probably another nurse practitioner depending on how the rounds go at your facility, usually a pharmacist, usually a dietitian, A lot of times respiratory therapists, some depending on where you are, sometimes the charge nurse is there, just different people. Sometimes you'll have OT, PT, like it just depends on the facility that you're at, but there's usually multiple people there. So it's nerve wracking because you're the only one speaking when it's time to present your patients, and you want to know, like you want to be great. You want to have everything right. You want to not forget something. And you're a student, so you're going to be nervous, and it's okay. You're going to mess up. You're going to trip over your words. You're going to not have the answer right there. Sometimes the doctor's like, what was their sodium? What was their last sodium? And their last sodium was 7 days ago. And you have your screen set up, or you have your paper, and you don't have that information right there. And it's kind of nerve wracking because you was on the flow and you had it going, and you was spitting, spewing, you kind of practicing in your head before. You wasn't expecting this question, and now you're like, and you're kind of, but it's okay. You can say, I don't have it right in front of me. Give me 1 second. And your preceptor, I keep saying instructor. I'm sorry, guys. All these times I've been saying clinical instructor, I've been meaning to say your preceptor. Your preceptor is usually going to help you, but also it's okay. Breathe, take a breath. They don't expect you to just know it. Like, you're not supposed to know every single lab. That's what the computer is for. You're going to go and you're going to get it and you're going to say it. But in that moment, even though you likely are nervous because it messed up your flow, fake it. Act like, hold on 1 second, doc, I got this. You don't gotta say it like that, but you can just smile and say, oh, 1 second, I wasn't prepared for that. Let me go look. And just fake it till you make it. And then after you get it, you're like, oh, messed me up. And now just breathe and get back on it. So that's what I mean when I say fake it till you make it. Obviously, if you don't know something, when it comes to patient and caring, all that, don't fake that. What I'm saying is the nerves. Try to cover that up. We understand you're going to be nervous. It's okay to joke. Like, I'm a little nervous if you do stumble over it. Just like make it a joke or something, and then get right back to where you were at. It's okay. It's literally okay. We get it. Every single one of us were in your shoes previously. We wouldn't be here if we weren't there before. Number 10, which kind of ties into number 9. Relax. Be yourself. I said be professional earlier. Definitely be professional, but also still be yourself. Relax. It's gonna be fine. You're learning. You're a student for a reason. We know it. Take a breath. Take a deep breath. Anytime you feel like your nerves are riling up, try to just really take a few deep breaths and restart. Try to relax. You got this. You made it this far for a reason. You're a great nurse. Remember why you are where you are. Remember where you came from. That's 10. I wanted to throw one more out there because when I said it, when I was in there, when I was reading the previous ones, it made me think. So a lot of times you will get to go to deliveries as practice as a student, and you'll be the head of the bed at delivery, depending on the type of patient or baby that is coming to the warmer. Usually we'll let the students be the head of the bed. You're never alone. Remember, your preceptor is there with you. But I was speaking about speaking your thought process out loud. When you're in a delivery, that is honestly probably one of the most important times to also speak your thoughts out loud. I learned that the hard way, where I was just thinking everything inside. Everybody's like, what are you thinking? What do you want us to do? What are you thinking? What do you want us to do? Like the transport and the respiratory therapists, they're used to this. They go to millions of deliveries. They've been doing this. So they're confident and comfortable. They're great support systems, but you're the head of the bed. They're trusting you. They're waiting for you to give direction of what to do next. So this is gonna take time. You may not get it the first, second, third time around, but try to remember to talk your thoughts out loud. Okay, baby came to the warmer. Baby is not crying or active. Let's try to stimulate and dry. How many, also while you're thinking, this baby is a 36 weeker, so let's just give him some time. Let's stimulate, dry, Okay, he's not crying, he's not responding. Can we start some PPV? I'm thinking we need to start PPV. You don't have to be super confident about it. You're a student. You guys think we should start PPV? You can ask too, because they've done it. Yes, we're gonna start PPV. What's your pressures? 20/5. Okay, we're gonna try. Can you put the pulse ox on? I'm thinking, okay, our sats, and check a heartbeat. What's the heartbeat? Is it greater than 60? Is it greater than 100? Blah blah. You're starting to think. I'm thinking, do we need to do this? Do we need to intubate? Can we have the breathing tube ready just in case? Like, you're still thinking. I know it's too soon. I'm just saying it out loud. Like, you just want to talk out loud so everybody can know where you're at, so they can know if they need to intervene. You know what I mean? That way, because we're all a team. We're all trying to resuscitate this baby and get this baby, breathing and active and everything together. So speak out loud. Don't be ashamed, even if you're wrong. It shows that you're thinking, you're critically thinking, and then everyone can also put their opinions out there. But if we don't know what you're thinking, then we don't know where to start or where to go from here, So don't be ashamed. last but not least, enjoy it. Be proud of yourself. Enjoy your clinicals. I'm so excited. I'm so glad that you guys clicked on my video. I hope that you enjoyed it. Again, if you have more questions or anything like that about any points that I made, please comment below. If you're a nurse practitioner and you're watching this and have any other key points or tips that I missed, please comment below. Thank you guys again for watching. Make sure you subscribe, like, share if you know your classmates or anything like that may need this. Please share it. Hit the bell button for notifications when I post a new video, and follow me on Instagram, signed Angel Janae, right there on the screen. Thank you guys again for coming to my channel. Love you.